Welcome to Connect Core. The goal of this program is to both relieve chronic lumbar and hip pain, as well as strengthen the core and the entire body from the inside out. So let's get started. What you'll need is some space, a mat, somewhere soft yet firm to lay on. We will be starting down in a hook lying position. Now, if this position with your knees bent is too painful for you, you can extend your legs out straight. You can also use a bolster or a pillow underneath your knees that have a semi-bend in them if that feels good for you too. But ideally, I'd like you in this hook lying position here. So to start off, we need to first learn how to take a proper breath as well as stack the rib cage on top of the pelvis. So what we're going to be doing to start off is identifying that space between your lower back to the floor. And first, before we do any sort of change of the body, I want you to take a normal breath in and then out. And do a couple of those. And just notice where you feel the movement or where you feel the air entering. Maybe it's a little bit up towards your chest, maybe it's kind of down toward your ribs. What we want to do to start is to fix that and learn how to, like I said, properly stack the ribs over the pelvis. And that comes from connecting to our core and working on our first connection point, which is the back connection. So what I want you to do is take your lower back and press that into the ground. And naturally your pelvis is going to do a pelvic tilt, but I don't want the effort to necessarily come from the hips. I want it to be from the back. So think of almost like you're trying to push or expand the back of your rib cage in to find that gentle connection. Everything we do in this video, I don't want it to be more than a 2 or 3 out of 10 effort at max. So again, it's not bracing 10 out of 10 for dear life like you're about to be punched in the gut. It's very subtle. Once you have that back connection point on, I want you to take your hands, place them on your lower rib cage, and work on trying to breathe and feel that expansion where your hands are, right on that lower rib cage. So let's take a breath in softly through the nose with the tongue on the roof of the mouth. And as you exhale, open your mouth like you're trying to fog a mirror, like a nice, soft, gentle sigh. Let's do that again, breathing in and out. Almost picture your diaphragm like an accordion. So when you inhale, you feel that expansion, keep breathing. And as you exhale, feel that drawing back in. And I want you to really feel, as you continue to breathe here, as I give you some coaching cues, that 360-degree expansion. So it's not just breathing into your belly, but it's global expansion, right? So into your belly, into your ribs, as well as into your back. And you should be able to feel that more of the back if you're keeping that back connection point. Now, one thing we haven't talked about yet is our rest of our connection points. And it starts with the feet, so it starts with grounding. So I want you to make sure that your feet are flat on the ground, your toes are up, and also you're not just heavy on your toes. The majority of the weight is on your heels, but I don't want you to lose your big toes. So drive through the heels, almost like you're about to lift your hips up, but then connect your big toes as well. Almost think of pronating your foot. So pronating would be kind of pushing the insides of your feet together. Naturally, that's going to almost shift your inner thighs a little bit closer together. You could use as a progression for this yoga block or a foam roller in between the thighs, but we're not quite there yet. I just want you to make the attempt of slightly bringing the thighs in together, having that kind of pronation foot contact point, big toes, the base of your big toe, it's your first metatarsal head, as well as your pinky toes though. So if you picture your foot, think of those 3 points of contact, the heel, the big toe, as well as the pinky toe. You can keep your hands on your rib cage. You can also bring your arms down to kind of get some more connection points, some more grounding. And then while you're there, don't let your shoulders round forward, kind of naturally draw them back, lifting your sternum start to explore a little bit of thoracic extension here by lifting the chest without losing that back connection point, right? So if you feel your chest as it starts to raise up, you've lost that connection point. Anchor that back down into the floor. And let's continue with another 3 or 4 breaths or so. If you come back to this video and you watch it, you can be practicing the breathing as I'm giving you the coaching cues, right? So don't stop with your breath, just kind of listen to the new cues that I'm giving to you and continue to do that breath. Ideally, you want about 3 or 4 seconds in, 3 or 4 seconds out. You can take your exhale a little bit longer. That's going to help you kind of get out of that fight or flight stance and activate more of your parasympathetic nervous system, more of your rest and digest or relaxation standpoint. So again, feeling those connection points to your feet, feeling your back connection. If you still need to have your hands on your ribs to kind of feel that, 360-degree expansion, that's good too. But keep going with that breath. Try to breathe wide into the ribs, and the slower you do that, the more air you're going to be able to get wide. Your diaphragm actually descends when you inhale, when you breathe in. So just think of that expansion coming down. That's going to drop the diaphragm down kind of through the abdomen, down into the pelvis, into the pelvic floor, really kind of helping open up everything through the ribs, through the pelvis, easing tension, letting your muscles and your fascia know that it's okay to kind of let go a little bit. And remember, make that inhale nice and soft, kind of open mouth. And then when you inhale, close your mouth back up again, tongue on the roof of the mouth, not clenching the jaw, relax your face. Everything is really soft and chill here. It's like a little mini meditation. If again you feel yourself kind of pushing or straining too much through the core, take a little break, kind of wiggle it out. Sometimes I catch myself like, oh, I'm at like maybe a 5 or 6 out of 10. You don't want to get there yet. It's really slow and gradual. All right, so let's take a little break from that. You can kind of unconnect your back from the ground, do some windshield wipers and wiggle it out side to side. So we're going to progress that back connection and start to incorporate a bridge and then a bridge march. So to really get the hamstrings and the glutes starting to work in connection with our core. All right, so again, feet contact points, back connection contact point, a little bit of a pelvic tilt here, but again, it's more about pushing that lower back in, kind of inflating your balloon, right? And now what I want you to do is start to push a little bit through the heels, almost like you're feeling your pelvis or your sacrum, right? The base of your hips. Start to unweight from the ground. So maybe your butt's still grazing the floor, but it's starting to unweight, and all of your lumbar is still in contact. So if you felt like L5, which is the lowest part of your lumbar, start to unconnect, keep that down. So you may need to do a little bit more of a pelvic tilt here to unweight your glutes or your hips while keeping every point of your lumbar, L1 through L5, all the way down in contact. This is going to turn on a little bit more of your deep abdominals. It's called your TVA, your transverse abdominis. When you inhale, I almost want you to think of like pushing your belly out and feeling that kind of almost like if we picture like a can of soda, right? When that's full, it's hard to kind of squish. But after you crack that can, right, the pressure releases and you can easier squish that can, especially if you take some fluid out. I want you to kind of maintain that full can there as you inhale, and even as you exhale, kind of think about keeping those abs turned on. This is going to kind of start to help our yin and yang from both the back side, because we're starting to elevate our glutes, as well as keeping the front side balanced. So again, kind of yin and yang as we walk or stand. Those two things can be triggering for lower back pain, but we want that counterbalance of both our posterior and our anterior kind of core system working together. All right, so we have our hips kind of unweighted. Maybe I'm starting to come up a little bit more. And again, just barely, like my L5 is starting to want to come off. I'm not coming up any more than that. Now what I'm gonna start to do is transfer the weight over to one of my feet. So maybe I was 50-50. Now give me like 80-20. 80 on the right, 20 on the left. And then go 80 on the left, 20 on the right. And kind of really slowly, I want you to start to go back and forth there. Feel that shift. You're gonna feel your hamstrings turn on here. Remember your contact points of your feet. That's important that you don't flare your knees out too wide or you don't supinate your feet, right? You want to stay pronated. So think of kind of pushing that arch down, keeping your big toe contact points. Keep doing that weight shift. I only want 80-20. Almost like you're about to lift that foot up, but it never quite comes out of connection. Remember, we're on the floor and we're connecting to our core. Don't lose the front of the abs. A lot of things to remember here. Don't feel too overwhelmed by this. Do your best. I'm sure you're doing fine. I want you to always remember, again, as I'm giving these coaching cues, to keep up with that breath that we started in the beginning. That is key. So you can inhale to one side, exhale to the other side, and then inhale as you're on that side, and then exhale onto the other side. So it's like a pendulum, right? So I'm on my right side. I'm going to take a breath in. And I'm going to transfer over to the left. Nice soft exhale. And I'm going to inhale as I'm still on my left. And I'm going to exhale as I'm onto my right. And we can kind of keep going back and forth with that pendulum. It's really, really slow. If you start to feel your neck or your jaw or any point up here start to tense up, kind of back down the tension a little bit. Reach your hands down towards your feet. Make sure there's no tension in the neck or your traps. Good, so let's take a little break from that. If you're starting to feel your lower back or your SI joints start to talk to you there, that's normal. It's just, again, we're really training our deep intrinsic muscles. Some of the muscles that have kind of shut off because you've been overworking your extrinsic muscles, your bigger muscle groups like your psoas, your hip flexors, your rectus abdominis. They've been doing all the work. They're working overtime. We're trying to wake up some of those sleepy workers, those really deep stabilizers that help your body out. So this can be quite fatiguing, even though we're not really doing a whole lot. So the third and final progression here for this kind of back connection point is to be up into a full bridge and then learning how to do more, that weight shift there, maybe even bring our feet up off the ground. So again, let's not rush. A baby's got to crawl before it can walk or sprint. So always run through all those connection points first. Your feet, your back connection point, your arms if they're down to your sides. This can kind of help with that lift off. Now I want you to make sure that L5, L4 are still in contact, and a little bit of that posterior pelvic tilt here to kind of turn on those lower parts of the glute max. And now what I want you to do is think about peeling one vertebrae at a time off the ground, kind of like you're peeling Velcro. So you're going from L5, L4, L3, L2, all the way up, still keeping that strong posterior pelvic tilt, still keeping those connection points. Again, try not to let your knees flare out too much. Keep your feet somewhat pronated with your big toes, your first metatarsal head glued to the ground, but not losing your heels or pinky toes. And see if you can come up. I don't want you going right into 100% of your maximum bridge, so don't really force that up. Stay at like between 50 and 75% while you can really maintain that pelvic tilt. And that's key there. You should be feeling some hamstrings, maybe a little bit of glutes. And what we're gonna do here is implement that pressure system breath while we're in the bridge. So I want you to think of kind of like pushing your belly out, almost like you're expanding through the obliques, to feel that kind of can expansion there. And then I want you to inhale, aim for that 4 seconds in, and then exhale, that nice, soft, gentle sigh, and feel that pull back in. And let's do some breaths here up in this proper glute bridge. Inhale, feel that expansion. And exhale, feeling your toes, feeling your heels. A couple more. And exhale, reinforcing that posterior pelvic toe. So now as the last progression here, we can try to implement that weight shift side to side. Really still kind of finding that little brace here. And go about 80-20 here, just barely making the attempt of wanting to lift off one foot off the ground side to side. Keeping your ribs down, don't let them kind of poke out. 80-20 side to side. I like to kind of, that same breath we were doing before, so it's like a pendulum, right? So inhale, and then exhale as you transfer to the other side, and then inhale on that side, and then exhale as you transition to the other side. So it's each kind of foot pressure gets an equal breath back and forth. Now, I want you to slowly come back down, one vertebrae at a time. Good, you can unweight, unconnect, kind of be loose, the yin and yang. If it feels good to do so, you can pull your knees up, give your low back a gentle stretch here. Don't crank it too much. Try to keep your low back and sacrum on the ground with this one. This feels good sometimes to come into hip flexion after being an extension. Those low back muscles, the erectors, the multifidus, they're going to kick on, and you want a strong back. So it's okay to feel your back on this one. Again, kind of note the discomfort between discomfort and pain. All right, so before we flip over and work on our front connections, we are going to do one thing to activate our deep transverse abdominis muscles as well as our rectus. So that same concept of finding our back connection, right? We got a little bit of anterior core with that one, but it was more focused on stimulating and activating the backside, the glutes, the hamstrings, right? So now we want this to be a little bit more direct here. Again, thinking building our shield of our spine, around our spine in front and the back. So now find that connection point, glue your back into the ground, and I want you to pick up one foot at a time and see if you can still hold that connection. So just, if I was really passive in this motion here with my feet up in this 90-90 position, my back is going to arch, especially because I have, more of an extension issue like a lot of people do. So, but what I want this to be is more of an active engagement from the core. So again, find that back connection point right through there. And even just that, you should feel those deep muscles of the core working here. The further you go out, the harder it's going to be. So that's where I want you at 90-90 to start. Now, as you hold this position, let's take a few breaths before we do any movement. So again, make sure your feet, knees, and hips are all lined up. Inhale, feel that expansion. Exhale, feel it draw back in. It's natural if your body wants to quiver a little bit, because this is challenging to hold this kind of active supine 90-90 position. Inhale, see if you can really feel that expansion, your lower back pushing even more into the ground. Almost like, you ever wear like those water wings around your arms when you were a kid? Picture like you have one of those inflatables around your spine, right? So when you inhale, you're inflating all those muscles, the diaphragm essentially 360 degrees. And then exhale. Now I want you to see if you can maintain that as we start to implement some heel drops here. You can do a few to start just to see how it feels with your body, noting any changes. If your back wants to arch, mine definitely does when I'm coming into hip extension, right? But now what I want you to do is sync your breath so that way when you drop, you're inhaling. And when you come back up, you exhale. We're inhaling in extension to help create that pressure by pushing that back down, and then we exhale, and we draw back up. Keep fighting to keep that lumbar and back connection point glued to the ground. And it's okay if you're feeling this in other parts of your core. If you're not feeling it in your core yet, if you're like, am I doing something wrong? If you're feeling it more in your quads or your hip flexors, that is okay. It's all part of this anterior chain. Again, it's a chain. So we're kind of addressing all the chinks in the chain or the weak links. So it may just be that your quads or your hip flexors may need a little bit of that strength to assist this motion. And another thing you can do is just really make sure to come back to this movement here and make sure you have that, right? That back glute in there. You can even implement as a kind of modification or regression to the heel drop. You can do what's called a TVA, transverse abdominal isometric, by pushing your hands into your knees. But again, really push your belly button down in there as you hold for breaths. This one immediately lights up my core. All right, so you can hit pause on the video if you want to do another 30 seconds or a minute of that, but I wouldn't do too much more. You should be feeling that. Always come back down to the yin of the yang of what we just did. Length and strength. Now we're loose. You loose to complement or counteract the tension. So that was all of our supine work or our back connection points. Okay. What we're going to do now is flip over to a prone position, work on our front connections. All right. So, right off the bat here, we want to make sure that our neck and shoulders, everything is nice and relaxed. So, no real tension to start. Try to almost like reach your feet away, lengthen out their hip flexors. I don't want you to be too arched or extended. Now our connection points from our back position was pretty much our lumbar. Our connection points here, actually we have two of them. And if we think, they almost kind of draw a triangle. If you were to look at the body from an upright position, the two in front are going to almost connect to the back and create this kind of sideways triangle shape. But the two I want you focusing on are basically the sides of the lower rib cage, as well as the front of the pelvic bone, more specifically the front of the pubic bone. So in order to get those in, we do have to use and recruit some glutes here on this one. So you're definitely driving your hips, again, that front of that pelvis down to get that connection point, as well as the rib cage. It's almost like, picture a baby getting tummy time, and that's one of the main reasons why, we do implement tummy time for infants, is to help them kind of develop this postural, this deep back line of fascia and extension muscles to help development and, again, balance of the spine and gaining those intrinsic muscles. So, all right, you got those two connection points, your ribs, as well as the front of the pelvic bone, the pubic bone. And I just want you to hold this position. And maybe you feel some tension or kind of your mid to low back muscles want to cramp. If you do, drop back down a little bit. And then all of the effort here is no more than a 3 out of 10. 1 or 2 is even better to start off with. So now as we sort of push both those two front connection points down, we're somewhat closing off this front space, right? It's almost like if we picture a balloon that's half inflated. And if we were to pour like a plaster or like a liquid cement over one side of the balloon, and then we were to try to blow that balloon up, the side that's uncovered with that plaster, that's what's going to expand. So that's kind of what we're doing here with our diaphragm. We are creating this little tension here in front, closing it off with the contact of the ground. So that way when we inhale, we are trying to expand these back low rib cage, which, there's a whole network of fascia and connection points here, and this muscle tends to get really tough at this thoracolumbar junction. And so if we can help use our breath and direct that breath from our diaphragm back there, we're not only helping our diaphragm stretch, but the diaphragm is acting on pushing out and helping stretching out some of those muscles. And again, fascia responds slowly. So we want to breathe slowly to really get that benefit here. All about managing pressure. This starts to bother your head or your neck, you can rest your head here, but just don't lose those contact points, those connection points of the ribs as well as the pelvic bone. I may bring my head this to help project my voice, but I want you to be cervical spine, head and neck in line with the rest of your spine. Let's do some more breath work. Again, as I'm giving you these coaching cues, I want you to keep breathing. Listen and breathe. That is your mission here. Think of that rib cage really expanding out wide. Breathe wide and breathe deep. Pour that glass of water slowly so none of it splashes out. You're feeling it from the bottom up. I have a really overactive, chronically kind of tight right psoas. When I do this one slowly and mindfully, I can feel my right psoas kind of letting go, that hip flexor. The breath truly is very powerful. All right, so just like we kind of wiggle it out and shake it out, if you want to come up into a little child's pose to shake it out, that's cool too. But we got one more thing to do in this kind of front connection point. It's very similar to the weight transfer, or the kind of a bridge transfer that we were doing. Essentially, we're doing some single leg lift-offs from this front or this prone connection point. So again, remember your two contact points here, your ribs as well as the front of your pelvic bone. Once you have that, I want you to take that inhale first, feel that expansion, feel that water wing expansion. And then I want you to lift up your right leg and then lower it back down as you exhale. And I want you to inhale, and then at the end of that inhale, lift your left leg and then exhale. And we're going to essentially kind of keep going back and forth there with those leg lifts. So we are training hip extension, right? Pretty much the same thing we did when we were laying supine in that hook lying position. We're training the front half of our body to stay connected through those anchor points. And you'll notice that you're going to want to lose that anchor point, especially the low front connection point, as you lift that leg. Try to really maintain that pelvic tilt. Try to maintain feeling your glutes, helping push your pelvis down, and only come up as high as you can maintain that position. It may only be what feels less than an inch for you, especially if those hip flexors are yet to let go, and they will, but we're training them from the inside out. We got to let them know that all these other smaller intrinsic muscles are going to start waking up and start helping out. You can start to experiment with some holds. Again, make sure you are syncing up your breath with the movement. Inhale, exhale on each lift off. Good, let's take a break. Let's come up out of there. Let's do some breath work in child's pose. If child's pose is too much for you for whatever reason, you can come down to your forearms, kind of be in like a modified quadruped position, or even up on your hands. Let's really try to slow that breath down here. We're breathing really deep into our hips and our pelvic floor on this one, sort of in an inverted position. It's going to change up the pressure pattern up a little bit and really help direct that breath down. And try to lengthen your inhale here a little bit more. Maybe see if you can get to 6 or 7, count in, and then just try to match that at least on your exhale. It's really slow, and you should feel that expansion almost down into your hips, almost like your hips are widening, your pelvic floor muscles deep into their glutes, and your hips are kind of almost blossoming out. And that exhale, I'm going to keep it soft and gentle. Open your body, get out of fight or flight, reaching that rest, digest, or relaxation, part of the parasympathetic nervous system. Nice work. And that's where we'll end today. That'll be our first lesson of our Connect Core. There's a lot more to follow up with this, a lot more in-depth we can do. This one, sorry for all the rambling, but I like to give as much coaching cues and details with this as possible, because when I was first learning this, all those little details really helped me kind of learn and connect the dots for my core, if you will. So again, there will be more on this. This is a kind of the foundation, the breath, with the connection of our front and our back, and learning how to really feel and be mindful of our spine. And that'll allow you to, when we get into some of these other movements like planking and side planking and other more challenging glute and core stability exercises, you've already built that baseline of awareness, right? Like I said before, a baby's got to learn how to crawl before it can walk, run, and then sprint. So it's always the order of operations. You're not just going to go do a rep max of something without properly warming up. And that is the whole purpose here with connecting to your core. So do this one, give it a shot, and let me know how it goes.